Helmets crashing, whistles blowing. It is that time of year again. Fall means football, and football means injuries. While we're busy cheering on our favorite teams, orthopedic surgeons are busy taking care of your favorite players. Dr. David Buchalter is an orthopedic surgeon and sports medicine specialist with OrthoMaryland, and he joins us this morning. Good morning. Good morning. All right, this is the time of year everybody looks forward to, but yes, injuries are part of it. What are the most common injuries that you see in football?
Well, the most common injuries are to the knee and other joints such as the ankle, the hip, and even the shoulder. There are a variety of types of injuries. There are sprains and strains, there are contusions, fractures, and even more serious ligament injuries, cartilage injuries, and dislocations.
And we see this from the youngest to the oldest. I mean, it doesn't matter if you're playing Little League all the way up to the guys on Sunday?
It doesn't matter at all. In fact, my son just started playing Little League this year, and every time I get whistled over, motioned over, Doc, can he keep playing? What can we do?
Okay, well, that is the question. How do you know when the injury is something that's going to sideline you and you really should stay off of it, or you can get back out there?
Right. Well, a lot of it depends on, every injury is different and every athlete is different, age in terms of goals and expectations. But the number one thing is the patient or the athlete has to be pain-free. They have to have full range of motion. They have to have strength that is at least almost equal to the other side, say if it was a knee injury or a leg injury or a hamstring injury. And they have to go through a series of functional tests to make sure that they can perform at the level that's expected.
And after an injury, what are the best ways to get them back to that point? I mean, does it always require surgery, or are there other ways to get them back in shape?
Right. Well, initially with any injury, there's the old saying RICE, rest, ice, compression, elevation. And that initial treatment is important because it decreases the inflammation and the blood flow that is going to the injured area and can help prevent an acute injury from turning into a chronic injury. So there's that aspect. Then there is the evaluation. And basically, what we need to do is determine whether or not it's something that is serious and will require surgery, or something that can be determined, can be helped with rehab.
All right, let me ask you about Ed Reed, because we have been missing him this season, and I'm sure you see injuries like what he had. Talk about what his injury is, and I know you have you treated him?
I haven't treated him.
But you've seen that injury plenty of times.
I've seen that injury. He has had a hip problem that has been going on for some time, and he had surgery on his hip out in Colorado. And the surgery that he may have been arthroscopic surgery to the hip. And there are actually very few surgeons in the country who perform arthroscopic surgery to the hip. And it's typically for a soft tissue tear, labral tears, sometimes some bone spurs. And it can be—
Oh, that sounds bad.
Yeah, it can be bad. And imagine if you're a safety and having to really fly through the field. It can be very difficult and a difficult recovery. So
it makes sense he was out for that length of time. But once he gets back in there, can we expect him to go full steam?
Well, that's to be determined.
Okay.
I think we're really we're hoping we're in a gray zone, depending on his recovery.
And of course, you want him to be, safe and pain-free. We want him in the game and we want to win, but his safety, I guess, is foremost.
Most important.
Yes, absolutely. All right. Thank you so much for coming in. We appreciate it. Interesting talking football, always. Well, for more information, you can go to foxbaltimore.com and click on Your Health Matters. Coming up.